you. My name is Anthony Harries, and I'm going to be talking about building operational research capacity in low and middle income countries. I've been involved, like many others, in operational research training around the world, and this is how we usually did it. We brought a class of 15 to 20 people together. We ran a 1 to 2 week course on methods and data handling. And then participants returned to their countries or their workstations, and very little happened, and very few people published any papers. I think the reasons are intuitive. People have no writing skills, people have no time, and above all, there's no mentorship back home to help them develop these research papers. So we have some data on this. I was involved for many years in an international TB course in Japan, and some of the participants on that course developed an operational research project, an ORP. So we followed 28 of these participants from Asia, Africa and Latin America to see what happened when they got home. And you can see the results on this slide. 11 of those people started operational research when they got home. 7 collected and analyzed data. Only 1 person wrote a paper, and to date, that paper has never been published. We need to do better than this. So in March 2009, the Union and Médecins Sans Frontières got together in Paris to work out how we would run a practical course for teaching the skills for conducting and publishing operational research. In 2012, the World Health Organization came on board with us, the Special Program for Tropical Diseases and Research, and we call these courses now SORT-IT courses. SORT-IT stands for Structured Operational Research Training Initiative. And essentially, this is an apprenticeship type approach. We combine training with implementation. It's product orientated, and at the end of the course we determine the success or not by whether a research paper has been submitted to a peer review international or national journal. There's a modular approach, and I'll go through this. 3 modules run over a course of 10 to 12 months. Milestones have to be achieved by participants to remain in the course, and we have targets that we have to achieve in order for our course to keep this brand of SORT-IT. Essentially, the research questions that participants come with are based on data already collected within the public health system or by non-governmental organizations. And we take our cue here from a very wise remark made by the Minister of Health in Fiji when I visited that country 4 years ago, who said to me, "Our country is data rich but information poor. We collect masses of data from all around the country, in clinics and in health facilities. That data goes into rooms like I show you here on that bottom slide, and nothing is ever done with them. We want to change this. We want to become a country that is data rich and information rich, and we hope operational research can do this." Our target audience, very simply, are implementers: doctors, nurses, paramedical officers, data analysts, monitoring and evaluation officers. And we never take more than 12 participants per course. And all 3 modules are to be completed, and these are funded through a scholarship through the Union and Médecins Sans Frontières. We have criteria for people who apply and who are hoping to become a successful applicant. These criteria are as follows. People must be engaged in program work and promise to return to that work. They must have their endorsement from their supervisor or director that they can attend the course and that they will have an opportunity and time to do the research when they're back home. They have to speak English, they have to be computer literate. We like people to have done a master's in public health or the equivalent, but often we get people who are just strongly recommended from ministries of health, and we will take those people if they fulfill the criteria. There has to be an acceptable mentor at the country level, although we don't often find that, and the funding for the research has to be acquired through other sources. And when people apply, they fill in a form, they submit a curriculum vitae, and on the application form they have to describe the protocol that they want to move with during the course, and that is quite important for us in selecting these applicants. They're very popular, these courses. You can see here that in our Paris course in July 2014, we had nearly 160 participants. And in our regional Asian course and African course, nearly 100 participants apply for just 12 places. So we disappoint a lot of people. This is essentially in one slide how the course runs. We have the first module of 6 days where people develop their research protocol. There's a day off, and then the next week they do module 2, 6 days of working out how to collect and analyze data using an open software package called Epidata. And then after about 9 months to 10 months, module 3, which is about paper writing. And you can see that all through this there are milestones, milestone 1, 2, 3 and 4, that participants have to complete in order to remain in the course. This is to ensure that we have good participants, and if there is somebody on the course who is really not interested, we are not then wasting our money on trying to get that sort of person through to the end, because this of course costs money. These are our milestones, and very quickly, milestone 1 is within 3 weeks of completing module 1, the protocol and the ethics form have to be submitted to our Union Ethics Advisory Group. Milestone 2 is within 2 weeks of completing module 2, Epidata documentation, which is quests, check and rec files, have to be submitted to the module 2 coordinator. 6 weeks before coming back to module 3, we have to have proof that the data has been collected. And finally, 4 weeks after the end of module 3, the paper has to be submitted to a peer-reviewed journal. Otherwise, we do not consider that participant to have completed the course. This is the teaching format. There's lectures and discussion. We have plenary presentations where the participants present their protocol and their paper as it is being evolved to everybody in the room, including their peers and including the faculty. And then very much we have hands-on mentorship that starts in module 1 and goes up until that paper has been accepted for publication. Just a little bit about the mentorship. We have in module 1 and 3, as you can see, 12 mentors and 12 participants. Very heavy on mentorship. And there's a reason for this, because we want to train young people essentially to be teachers. So how this works is that we have 6 mentor pairings. We have a senior and a junior facilitator in each of those pair groups. So for example, I would be a senior facilitator and I would work with somebody from Africa or Asia as a junior facilitator. And we will look after 2 participants from start to finish. In module 2, because it's to do with data handling, then we have 6 mentors, essentially 1 mentor for 2 participants, and again those mentors see those participants through from the start to the end. It's very much hands-on. We develop versions during the modules, we provide support between the modules, and the mentors are co-investigators and also co-authors. When participants have completed their course, they get a certificate of completion like this, which is essentially stamped and endorsed by WHO. Finally, what are the targets to be achieved? We call these the 80-80-80-80 targets. Let me quickly go through. So essentially for each module, participants score us on terms of how the teaching went, how the mentorship went, what the facilities were like, and we have to get an aggregate score of 80% or more. We expect that 80% or more of our participants who start the course finish the course, completing all milestones. We expect that 80% of the papers submitted for publication are published within 18 months of submission, and we expect that 80% of those papers are assessed for their effect on policy and practice. So does this model work? Let me take you through our statistics. This was the first course that we ran in Paris in April 2009. 12 participants, 6 from Africa, 6 from Asia, 6 men, 6 women. You can see that 11 participants completed the course. So 1 participant failed, in fact, to complete all milestones. 14 papers were submitted to peer-reviewed journals, so meaning that 3 participants, in fact, did 2 papers each, and 14 of those papers were accepted for publication. And then what happened from this is we chose 3 good people, good participants from this first course to become facilitators on our next course. So these are the metrics up to the end of March this year. You can see that we've run 25 courses. You can see where these have been run, 5 in Paris, 3 in Luxembourg, 3 in India, 3 in the South Pacific, 4 in Asia, in Kathmandu, Nepal, 4 in Ethiopia, in Addis Ababa, 2 in Eastern Europe, and 1 in Latin America. And nearly 300 participants enrolled. This is a slide showing you research capacity globally, and you can see that essentially that research capacity is in North America and in Europe. If you look at where we are training people, it's where the gaps occur. So here we have those 25 courses, 293 participants enrolled from 72 countries around the world. This is slightly misleading, this slide, because you can see Brazil on the left. It looks like we've covered the whole of Brazil, but in fact we've only trained 5 people in that country. But nevertheless, Brazil is targeted there as a country. Look at what the projects are undertaken in these 25 courses. You can see that we have a big focus on tuberculosis, HIV tuberculosis, diabetes tuberculosis. We have quite a concentration on HIV/AIDS on its own, and then we deal with a host of other things. Maternal and child health, malaria, neglected tropical diseases including Ebola, malnutrition, and then under other we deal with smoking, non-communicable diseases, cancer, and so on. This shows you outputs from 20 of those 25 courses that have been completed. So just to give you an idea of the metrics. So 236 participants started those 20 courses. 213, 90% completed with all milestones. So not bad, but 10% still fail to achieve full completion. 247 papers submitted to peer-reviewed journals, and as of the end of March, 84% of those papers published or in press. Where do we publish our papers? Well, in a variety of journals. Here I've shown you some. BMC Infectious Diseases, Public Health Action, the Transactions of the Royal Society of Tropical Medicine and Hygiene, PLOS1, Tropical Medicine International Health, and International Journal of TB and Lung Disease. We have a preference for open access journals, meaning that the author, in fact, pays for the privilege of publishing, and the reader reads this free of charge. So these are the common open access journals we go for: the PLOS journals, Public Library of Science journals, the BMC journals, which stand for Biomedical Central Journals, and also Public Health Action. Why an emphasis on papers? 3 important reasons. It's a quality control standard. It means that that project designed by that participant has been taken through to completion, it's been written up, it's gone through peer review, a tough peer review, and it's been published in a good journal. It has to be a good quality project in order to go right through to that end. Secondly, more and more now, international guidelines and national guidelines are evidence-based, meaning you have to publish your work, it has to be there in the scientific literature in order for it to change policy and practice. It's a critical way of disseminating knowledge, particularly using open access journals, because this is free for the readership. It also makes the authors experts at that moment in time, and this brings credibility to that person and also to their institutions. There's two great quotes I'd like to mention to you. There's an ancient Roman proverb that goes, scripta manent, verba volant. Spoken words fly away, written words remain. What I say to you just now has evaporated into the cyberspace, but what is written stays. And then one of our great literary writers, Virginia Woolf, once wrote very wisely, if you do not write about it, it did not happen. And I think this is why we really put an emphasis on publishing the research that we have done. But it's more than that. We go beyond papers and we want to influence policy and practice. And my colleague, Ronnie Zachariah, will talk to you more about this in the lecture that follows this. But just to show you, this is 6 examples of research done that made quite a big difference. Research done during these courses from South Africa and Malawi showed that using pharmacy records could be a very good and simple way of determining who is retained on antiretroviral treatment. A lot of work using or basically testing out the screening of tuberculosis patients for diabetes mellitus in India changed policy in that large country. Work done by Médecins Sans Frontières in Liberia and Kenya on caring for victims of sexual violence altered the way in which those victims were managed and looked after. And on the right, work done on smoking, on telemedicine in Somalia, a very difficult country for expatriates to work in, and in Burundi has changed policy and practice. Just to look at the outputs from our first 8 courses, did we meet those 80 targets? And the answer is yes, we did. You can see that we scored well on the modules. You can see that nearly 90% of our participants enrolled, in fact, completed the course. 93% of those papers submitted were published 18 months later, and almost all of those papers were assessed for their influence on policy and practice. Did they make a difference? Well, this is a self-reported questionnaire. At the moment, we haven't quite worked out objectively how to determine whether research does make a difference. But according to this questionnaire returned from the participants writing these 88 papers, according to them, 3/4 of those papers, that research made a difference. You can see that in 27 cases, program implementation changed. In 24 cases, monitoring tools were adapted. And in 20 cases, there was a change in existing guidelines. People often ask me, is this expensive? What we've done here is put in the costs, the total costs of running this course, which includes flying people to the venue, hotel accommodation, per diem, paying for open access publication. And you can see that essentially this works out at 6,800 euros per paper. We have nothing really to compare it with except a publication in 2012 looking at European Union funded research, where the cost per paper was 224,000 euro. Now, it's a bit unfair, this comparison, because that is research looking at randomized controlled clinical trials, very different to operational research. But nevertheless, I think it shows that what we do can be done quite cheaply. When participants are finished with us, we ask them to join an alumni network. This is a web-based organization. We track people after the course is finished, and essentially we use this to bring people back to help us teach on courses, to help them write papers, and we hope that they will become professors of operational research. So we track this. So again, just to give you some metrics on this, we tracked 76 participants who had completed the course 18 months or later after completing. And we found that 62% were continuing to do research projects and completing them. 50% had published additional papers after the course had finished, and 43% were facilitating at other operational research courses. We are very pleased with this output, and it shows, I think, that it's not just a one-off, and people learn about OR, operational research, and they become enthusiastic about this and take it on. So in conclusion, I'd like to say that this training is a target-orientated training. The products are papers and the influence of those papers, that research, on policy and practice. And finally, our long-term vision is to build capacity and to develop leadership in low and middle income countries in operational research. One day, I hope you'll apply and try and get on one of these courses. Thank you.